The silent nerve compression because your doctor might be overlooking this year. What if the burning, numbing pain running down the front of your thigh isn't coming from your disc at all? What if it's not your spine that's the problem, but a muscle buried so deep inside your hip that most doctors never even think to check it? It's called the psoas, and when it gets tight, it can quietly strangle a major nerve, creating symptoms that look exactly like a herniated disc. Today, I'm going to show you exactly how this happens, how to tell if it's happening to you, and the specific release techniques that can undo it, starting right now. Here's something most people never hear from their doctor. Not all leg pain comes from your spine. For years, if you had numbness, tingling, or burning running down the front of your thigh, the assumption was disc compression. Get an MRI, find a bulge, blame the disc, move on. But there's another structure that can cause the exact same symptoms, and it almost never gets checked. It's called the psoas muscle, a deep hip flexor that runs from your lower spine through your pelvis and attaches near the top of your thigh bone. Right next to it runs the femoral nerve. And when the psoas becomes chronically tight, which happens to almost everyone who sits for a living, it can compress that nerve. The result is thigh pain, numbness, or a burning sensation that mimics disc-related sciatica almost perfectly, except it usually sits more on the front and inner thigh rather than the back of the leg. I'm Dr. Dan, and here on Health Fix Zone, we go deeper than just stretch it out. Today, I want to walk you through why this happens, how to actually tell the difference between psoas-related nerve compression and a real disc issue, and then the specific myofascial release techniques that target the root cause. Now, I do want to say this clearly. I'm not telling you to skip your doctor. If you're dealing with sudden, severe numbness, loss of bladder or bowel control, or rapidly worsening weakness in your leg, that needs immediate medical attention, full stop. What I am telling you is that for a huge number of people with chronic nagging thigh pain who've been told it's probably your disc without a clear diagnosis, this might be the missing piece. And stick with me until the middle of this video because I'm going to show you a 30-second self-test that can help you figure out which one you're actually dealing with. And it's genuinely surprising how many people get this wrong. Chapter 1: Why sitting creates this trap. Let's talk about why this is becoming so common. The psoas is what's called a hip flexor. Its entire job is to pull your knee up toward your chest. Think walking, running, climbing stairs. But here's the problem. When you sit, your hip is already flexed. Your knee is already up near your chest angle. So the psoas spends 8, 10, sometimes 12 hours a day in a shortened position. Muscles that live in a shortened position for that long adapt. They tighten. They lose the ability to fully lengthen. And because the psoas sits so close to your spine and directly alongside the femoral nerve, that chronic tightness starts to create pressure right at the point where the nerve passes through. This is what I call a mechanical trap. It's not inflammation, it's not a bulging disc, it's not something that shows up clearly on a standard MRI, because MRIs are built to look at your spine and your discs, not the soft tissue tension in a muscle. So people go through rounds of spinal imaging, get told everything looks fine or mild, and walk away with no answers, while the actual source of their pain never gets examined. And here's the part that catches people off guard. This doesn't just affect people who sit at a desk. Drivers, people who sit in wheelchairs for long periods, even people who sleep in a curled up fetal position every night. Anyone with prolonged hip flexion is a candidate. Chapter 2, the self-test. Is it your psoas or your disc? 5 o'clock, 7:30. Okay, here's the test I promised you, and I want you to actually try this with me. Stand at the edge of a table or a sturdy bed about hip height. Lie back on it so your tailbone is right at the edge, and let one leg hang down off the side while you pull the opposite knee into your chest with both hands. If your hanging leg stays roughly level with your hip or drops down easily toward the floor, that's a good sign. Your psoas has decent length, but if that hanging leg is stuck up in the air noticeably higher than your hip, and you feel a pulling sensation deep in your front hip or groin, that's a strong indicator your psoas is short and tight. Now here's the differentiator. Disc-related nerve pain typically gets worse when you bend forward, sit for long periods, or cough and sneeze, because those movements increase pressure inside the disc. Psoas-related nerve compression tends to do the opposite. It often gets worse when you extend your hip backward, like during the second half of a walking stride, or when you've been sitting sitting all day and then stand up and try to straighten fully upright. If standing up straight after sitting brings on that burning, pulling sensation in your front thigh, that's your psoas talking, not your disc. This isn't a replacement for a proper clinical exam, but it's a genuinely useful way to start narrowing down what you're actually dealing with before you walk into another appointment. Quick pause here because I know some of you are already feeling that tightness as I describe it. I put together a free downloadable guide that walks through this self-test with photos plus a printable version of every release technique I'm about to show you, so you're not trying to remember all of this. It's linked in the description below. Grab it, it's completely free. And if this is the first time someone's actually explained why your leg pain might not be your spine, do me a favor and hit that like button. It helps this video reach other people who've been stuck getting the same unclear answers you have. All right, let's get into the actual release work because this next part is where things start to change. Chapter 3, the myofascial release. This is the core of what I want to show you today. 3 specific techniques done in sequence that target the psoas directly and take the pressure off that femoral nerve. First, the self-release with a ball. Lie face down and place a firm ball, like a lacrosse ball, just to the side of your belly button, slightly toward the hip you're working on. You want to sink in slowly, not aggressively. Breathe deeply for 30 to 60 seconds, letting your body weight sink into the tissue. You're not digging for pain, you're encouraging the muscle to release under sustained, gentle pressure. Do this on both sides, even if only one side is symptomatic, because tightness is rarely isolated to just one. Second, the kneeling psoas stretch. Get into a half kneeling lunge position, back knee down on a cushion, front foot flat on the ground. Gently tuck your pelvis under, almost like you're flattening your lower back. Then shift your weight forward until you feel a stretch in the front of the back hip. Hold this for 30 seconds, 3 rounds per side. The pelvic tuck is the part almost everyone skips, and it's the part that actually isolates the psoas instead of just stretching your quad. Third, and this is the one that changes everything for most people, the active psoas release. Lie on your back with both knees bent. Actively squeeze your glute on the side you're working while gently pressing your lower back into the floor. Hold for 5 seconds, release, repeat 10 times. This teaches your glute to take back some of the work your psoas has been compensating for, which is often the actual reason the psoas got overworked and tight in the first place. Most people only stretch, almost nobody retrains the muscle that's supposed to be sharing the load. That's the missing step. Chapter 4, undoing the daily pattern. Here's the thing though, you can do all 3 of those release techniques perfectly, and if you go back to 10 hours of sitting with your hips flexed, you're just going to recreate the same tightness by tomorrow. So a few small daily adjustments matter here. If you're at a desk, try to stand up and fully extend your hips, just walking around for 2 minutes, every 45 to 60 minutes. If you drive long distances, take a break every couple of hours to stand tall and reverse that hip flexion, even for 60 seconds. And if you sleep curled up in a fetal position every night, try occasionally sleeping on your back with a pillow under your knees instead, so your hips get a break from that shortened position overnight too. None of these changes need to be dramatic. It's the accumulation of small, consistent breaks from hip flexion throughout your day that actually prevents this from rebuilding. So here's the piece I really want you to walk away with today. Nerve pain running down your leg does not automatically mean disc problem. The psoas sits close enough to the femoral nerve that chronic tightness alone can create pain, numbness, and burning that convincingly mimics a disc issue. And it's a source that standard spinal imaging is not designed to catch. That doesn't mean ignore your doctor, and it doesn't mean self-diagnose everything. It means if you've been told your imaging looks fine, but you're still in pain, or you've done all the standard disc-focused advice and nothing's changed, this is a legitimate area worth exploring, either on your own with the techniques I just showed you, or by asking a physical therapist specifically to assess your hip flexor and psoas function, not just your spine. The muscle causing your pain and the structure everyone's looking at are not always the same thing. So to sum it up simply, that burning pain down your thigh might be coming from a tight psoas compressing your femoral nerve, not from your disc. And the release, retrain, and daily movement approach I showed you today is how you start undoing it. If you found this helpful, there's a video I made on the exact desk setup that's quietly wrecking your hips and lower back all day. That's the perfect next watch if you spend most of your day sitting. Hit subscribe if you want more videos like this, ones that actually dig into what's happening underneath the surface instead of just handing you generic stretches. This is Dr. Dan, and I'll see you in the next one, right here on Health Fix Zone.